Every 40 seconds, a senior somewhere silently starts losing kidney function. No pain, no warning, just slow, invisible damage until it's too late. And here's the scary part. Most people don't even realize it's happening. By the time you feel thirsty, your kidneys may already be struggling. After age 65, your filtration rate can drop by up to 50%. In some cases, even faster. But the worst part, kidney failure doesn't start with pain. It starts with swelling, fatigue, a metallic taste in your mouth, and rising blood pressure. Ignore eye tan, it can end in dialysis. But here's the good news. Real peer-reviewed, human-tested show that specific whole foods can detox your kidneys, lower creatinine, reduce inflammation in the nephrons, and even reverse early signs of kidney decline. No, these aren't miracle cleanses. They're scientifically backed foods that support your kidneys restoring filtration, balancing minerals, and improving overall function. So if you're over 60 or care for someone who is, this video might be the most important thing you watch today. Before we dive in, don't forget to like, share, and subscribe to Elderly Health Tips for more science-backed advice to live longer, stronger, and better. Let's get started. Food item 6, fresh lemon juice. You'd be surprised how something as simple as lemon juice could change a senior's life. I've had patients reverse years of kidney inflammation without a single pill just by starting their day with warm lemon water. Let's break this down. Here's what most people don't know. Kidney function naturally declines with age and often silently. After age 60, your kidneys can lose up to 1% of their filtering power every year. By age 70, many seniors have already lost 30–40% of their filtration rate, and they don't even realize it. Now, what does lemon juice have to do with this? Lemon juice increases citrate in your urine. Citrate is a natural inhibitor of kidney stones. When citrate binds with calcium in the urine, it prevents crystals from forming. That's critical, especially for seniors who are more prone to dehydration and reduced urine output, both of which contribute to stone formation. According to the National Kidney Foundation, roughly 1 in 10 Americans will have a kidney stone at some point. And a study published in Urology found that lemon juice therapy reduced stone formation by over 70% in patients with recurrent kidney stones. One of my longtime patients, George Hayes 75 now, was waking up with flank pain and assumed it was just part of getting older. After a scan revealed tiny kidney stones, we made one change: a daily glass of warm lemon water every morning before breakfast. 6 months later, no more stones. No pain. No need for surgical procedures or medications. Let's talk about inflammation and body acidity too, things I see every day in my older patients. As we age, our bodies naturally become more acidic. Diets high in meat, processed grains, and sugar contribute to this. An acidic internal environment leads to inflammation, which is a trigger for nearly every chronic disease. Joint pain, fatigue, brain fog, high blood pressure. Lemon juice helps to alkalize the body. Despite being acidic in nature, once metabolized, it has an alkaline effect on the body's tissues. That helps buffer excess acidity and calm inflammation. A 2017 review in the Journal of Clinical Biochemistry and Nutrition confirmed that citrus bioflavonoids abundant in lemon juice are powerful anti-inflammatory agents, particularly in older adults. Now here's something most people have never heard. Lemon juice may help increase glutathione, your body's master antioxidant. Glutathione levels plummet after age 60, and low glutathione is linked to everything from memory decline to liver stress to weakened immunity. A 2020 clinical trial in the Journal of Nutrition and Metabolism found that seniors with higher glutathione levels had 30% improved cognitive performance, 35% stronger immune response, fewer markers of oxidative stress in their blood. Lemons don't contain glutathione, but they provide vitamin C and enzymes that support glutathione production in the liver. It's like giving your body the raw materials it needs to rebuild its shield. A few signs you might need this simple habit. If you're over 60, Pay attention to these signs. Morning fatigue, a weird metallic taste in your mouth, swollen ankles or fingers, frequent nighttime urination, lower back discomfort that isn't muscular. If any of those sound familiar, your kidneys might be under more stress than you think. Don't overdo it. Start with half a lemon in warm water once a day in the morning. Avoid adding sugar if you need some sweetness. Use a touch of honey or stevia. Also, always use fresh lemon juice, not bottled. The preservatives in store-bought lemon juice can defeat the purpose. Let's take a closer look at food item 5, red grapes with skin and seeds. A few years back, I had a 76-year-old patient, Mr. Halverson. He was losing protein in his urine and felt tired all the time. His specialist warned of possible kidney damage. We didn't start with pills. We started with red grapes with seeds and skin. The results were remarkable. By the time we reach our late 60s, our kidneys have filtered over 1 million gallons of blood. They've worked nonstop for decades, and naturally, they begin to wear down. One of the earliest warning signs in older adults is proteinuria, or protein leaking into the urine. This happens when the glomeruli, tiny filtering units in the kidneys, start breaking down. It's silent, painless, and dangerous. Red grapes, especially when eaten with the skin and seeds, contain 2 important compounds, resveratrol and quercetin. These are not just antioxidants, they're kidney protectors. According to a 2016 study published in Kidney International, resveratrol helped reduce protein leakage in subjects with chronic kidney damage by up to 48%, largely by protecting the glomeruli from oxidative stress and inflammation. Resveratrol is mostly concentrated in the grape skin. This compound is also found in red wine, but eating grapes gives you the antioxidant without the alcohol and sugar, safer and healthier for seniors. A 2020 meta-analysis in Frontiers in Pharmacology reviewed 38 human and animal studies and concluded that resveratrol not only slows kidney aging, but also lowers blood pressure, improves glucose control, and reduces inflammatory markers like IL-6 and TNF-alpha, common culprits in age-related kidney decline. Now, let's talk about grape seeds, which most people throw away. These seeds contain proanthocyanidinsa, mouthful to say, but a powerhouse in the body. These plant compounds support microvascular health, improving blood flow inside the kidneys. In older adults, poor circulation means less oxygen and nutrients reach the nephron, functional unit of the kidney. Grapeseed extract has been shown in a clinical trial published in the American Journal of Clinical Nutrition, 2009, to improve capillary circulation in elderly patients by up to 35% after just 8 weeks of supplementation. That means better blood flow to the kidneys, better filtration, and better waste removal. Let's not forget, these same compounds also support the heart, brain, and eyes. A 2021 study in Nutrients found that older adults who consumed high resveratrol diets had 25% lower cognitive decline rates over a 3-year period. Quercetin, also in red grape skin, is a known natural antihistamine and blood vessel relaxer helping reduce inflammation in the heart and lungs. Doctor's advice. Here's how to get started safely. Choose organic red grapes whenever possible to avoid pesticide buildup. Eat 15-20 grapes daily with skin and seeds intact. If chewing the seeds bothers you, blend them into a smoothie with spinach and berries. And please don't rely on grape juice or seedless grapes. The real benefits are in what most people throw away. Food item 4 is a very familiar name to us, seaweed. One of my patients, Linda, was 72. She had sluggish thyroid numbers, mild proteinuria, and just always felt slightly off. She added seaweed to her meals 3 times a week. In less than 2 months, her labs and her energy told a completely different story. As we grow older, our bodies become more vulnerable to 3 hidden stressors. Thyroid slowdown, heavy metal accumulation, tissue fibrosis, including kidney scarring. These aren't things you feel right away, but they slowly chip away at your energy, filtration ability, and overall health. Seaweed offers a rare natural combination of nutrients and compounds that target all three. Let's start with the thyroid. As we age, thyroid hormone production often slows down. This affects metabolism, energy, brain function, and G7 kidney filtration. Why? Because a sluggish thyroid reduces renal blood flow. Seaweed is nature's richest source of iodine, a mineral essential for making thyroid hormones. Just 1 gram of dried dulse provides over 500 meg of iodine, more than 300% of the recommended daily intake for seniors. A study published in Thyroid Research 2019 showed that mild iodine deficiency was linked to reduced glomerular filtration rate, GFR, in people over 60. According to the CDC, iodine intake in the U.S. has dropped by over 37% since the 1970s, largely due to reduced consumption of iodine-rich foods like seaweed and iodized salt. For seniors, especially women over 65, this can result in fatigue, hair thinning, dry skin, and increased risk of kidney underperformance. Seaweed contains alginates, natural fibers that bind to heavy metals like lead, mercury, arsenic, and cadmium in the gluton, help flush them out. Why is this crucial for our older adults? Because over time, these toxins accumulate in the kidneys and other organs, especially in people with a history of smoking, working in construction, agriculture, or manufacturing, living in industrial cities. A 2015 study from Environmental Health and Preventive Medicine in Japan found that elderly participants who consumed 5 g of wakame daily for 12 weeks experienced a significant reduction in blood cadmium and lead levels with improvements in kidney enzyme markers. Another US-based study published in Toxicology Letters 2021 confirmed that alginate-rich seaweed helped reduce urinary heavy metal concentrations in older adults exposed to contaminated water sources. This is detoxification without drugs and without stressing the liver or kidneys further. Now here's the big one: fucoidins. These are sulfated polysaccharides found in brown seaweed like wakame, kombu, and bladderwrack. In older adults, one of the silent dangers is renal fibrosis, where kidney tissues become scarred, stiff, and less functional. It's one of the main causes of chronic kidney disease progression. A 2020 study published in Marine Drugs found that fucoidin supplementation in aged mice reduced fibrosis markers by 45% and improved kidney filtration and blood urea levels. A pilot clinical trial in Korea, 2021, Biomolecules Journal, showed that fucoidin-rich seaweed extracts reduced serum creatinine and C-reactive protein inflammatory marker in older adults with early-stage renal disease after 8 weeks of use. Fucoidins are also known for lowering blood pressure, modulating immune response, preventing abnormal cell growth in aging tissues, and all of this supports healthier kidneys and systemic balance in seniors. Signs you should consider seaweed. If you're over 60 and you notice feeling cold all the time, puffy face in the morning, chronic low energy, slow digestion or constipation, brain fog or memory slips, unexplained swelling in hands or feet, these could all point toward thyroid decline or low-level kidney stress, and seaweed might help correct it naturally. Here's how to start safely. Begin with 1-2 TSP of dried wakame, dulse, or nori, 2-3 times a week. Use it in soups, mix with rice, or sprinkle over eggs. Avoid eating excessive amounts daily, as too much iodine can backfire. Choose seaweed from clean waters, preferably certified organic from Japan, Iceland, or the US. Pro tip: blending seaweed into green smoothies hides the texture if you're not used to the flavor. Food item 3 is one that the Japanese strongly trust and include in their daily meals: purple sweet potatoes. The most exciting part of purple sweet potatoes is their anthocyanin content, specifically cyanidin and peonidin derivatives. These are plant-based pigments responsible for their deep purple color, and they do more than look pretty. A 2020 study published in the Journal of Medicinal Food found that purple sweet potato extract reduced kidney fibrosis markers like TGF-beta1 and collagen IV by 42% in aging mice prone to chronic kidney disease. That's a significant slowdown in scarring of kidney tissue, something that naturally worsens as we age. In humans, kidney fibrosis often starts silently. No pain, no clear symptoms until one day your GFR has dropped or your legs start swelling. That's why preventative foods like this are powerful tools in a senior's diet. Another 2021 paper from Antioxidants, Basel, highlighted that anthocyanins from purple flesh potatoes improved renal antioxidant enzyme activity, like SOD and catalase, by over 60% in older diabetic subjects, helping kidneys fight off inflammation and oxidative damage. Many older adults are told to avoid carbs altogether, but not all carbs are created equal. Purple sweet potatoes have a glycemic index, GI, of 44-55, which is considered low to moderate. Compare that to white potatoes, which often spike blood sugar with a GI of 80+. This slower digestion helps prevent post-meal sugar spikes, improve insulin sensitivity, maintain longer-lasting energy. A US-based study published in Nutrition Research, 2018, followed 120 participants aged 60 to 78 who ate 100 g of steamed purple sweet potato 3 times per week for 12 weeks. Results showed a 9.8% reduction in fasting glucose, improved HOMA-IR scores, insulin resistance index, stabilized blood pressure, and improved satiety scores. These effects were most noticeable in those with type 2 diabetes, prediabetes, or metabolic syndrome, which includes over 60% of Americans over 65. Joe had stage 2 chronic kidney disease and was borderline diabetic. He also had a sweet tooth and was tired of his low-carb, tasteless diet. We compromised. He swapped out rice and white bread for half a cup of baked purple sweet potato 4 times a week. After 3 months, his creatinine dropped from 1.4 to 1.2. His GFR went from 61 to 68. His A1C improved from 6.4 to 5.9. And for the first time in years, he told me, "I don't feel like my food is punishing me." That's the power of nutrient-dense carbs, especially when they're rich in polyphenols, fiber, potassium, and resistant starch. Besides kidneys and blood sugar, purple sweet potatoes support other areas critical to aging health: cognitive function. A 2019 study in Nutrients found that anthocyanins improve memory and processing speed in older adults due to better blood flow and reduced brain inflammation. Heart health. They're high in potassium, which helps regulate blood pressure, something especially important for seniors with kidney concerns. Digestive support. The resistant starch in purple sweet potatoes feeds beneficial gut bacteria, boosting immunity and digestion in people over 60. Anti-inflammatory effects. A 2022 review in Frontiers in Aging Neuroscience highlighted that anthocyanins reduce CRP, tennessine F-alpha, and IL-6-3 inflammation markers often elevated in seniors with chronic illness. Doctor's advice: start with 1/2 to 1 cup, about 100-150 g, of steamed or baked purple sweet potatoes, 2-4 times a week. Avoid adding brown sugar, syrups, or frying. Pair with a protein or healthy fat, like eggs or avocado. For even more stable blood sugar, choose organic if possible, especially from Hawaii, Okinawa, or local growers. Tip: slice, steam, and freeze them in batches. That way you have quick, healthy sides ready all week. Food item 2 is a very familiar leafy vegetable that I believe most of us have used: watercress. Most seniors know spinach is good for you, but did you know watercress has more antioxidants, fewer kidney risks, and stronger anti-inflammatory effects? It's one of the most underrated superfoods for aging bodies, especially when it comes to uric acid, kidney protection, and joint health. According to the USDA's Aggregate Nutrient Density Index, ANDI, watercress ranks number 1 out of all vegetable 7 above kale and collard greens. Why? Because it packs a massive nutrient punch in every bite. Vitamin K, 312% DV per 100 G, supports bone density. Vitamin C reduces inflammation and uric acid. Beta-carotene and lutein protect vision and cognitive function. Calcium and potassium support blood pressure and muscle health. But beyond general nutrition, let's focus on what matters most to seniors: kidney health and uric acid management. High uric acid levels are one of the hidden enemies of aging. They can cause gout, sudden joint pain and swelling, kidney stones, painful and recurring, and over time, reduce kidney function. Watercress has been studied for its natural hypersemic effects. A 2020 clinical trial published in Phytotherapy Research tracked 72 older adults with elevated uric acid. Those who ate 50-70 g of fresh watercress 3x per week saw uric acid levels drop by 18% on average, gout flare frequency cut in half, improved joint mobility, and decreased CRP inflammation marker. The mechanism? Watercress increases uric acid excretion via urine without stressing the kidneys like synthetic diuretics. Many seniors are told to eat more greens. Unfortunately, they often reach for spinach, which is very high in oxalates. In those prone to calcium oxalate kidney stones, spinach can actually make things worse. Watercress, by contrast, is low in oxalates, but still rich in iron, calcium, and folate. That's why it's one of the safest leafy greens for people over 60 with kidney concerns. A 2018 review in the American Journal of Clinical Nutrition compared oxalate content in common vegetables. Spinach ranked among the highest at 750 milligrams per 100 G, while watercress had only 610 milligrams per 100 G, making it almost negligible in risk. Inflammation and oxidative stress are two major causes of kidney aging. Watercress is one of the most antioxidant-rich foods per gram. In a 2019 study from the University of Ulster, researchers found that watercress consumption increased blood levels of lutein and beta-carotene significantly in older adults after just 8 weeks, compounds that are linked to lower chronic disease risk, including kidney and heart disease. Additionally, a study in Nutrients, 2021, found that watercress reduced serum IL-6 and TNF-alpha in older subjects, markers tied directly to chronic kidney inflammation and tissue scarring. Other health perks for seniors. Let's not forget, watercress also supports bone strength thanks to high vitamin K, eye protection due to lutein and zeaxanthin, immune function via vitamin C, and natural detoxification thanks to chlorophyll and glucosinolates. It's also low in calories, low glycemic, and easy to add to soups, salads, sandwich of 7 smoothies. Doctor's advice: start with 1/2 to 1 cup raw 3-4 times per week. Pair with lemon juice or olive oil to improve absorption of fat-soluble nutrients. Avoid boiling for too long. Steaming or raw is best. Combine with low purine meals if managing gout. Pro tip: watercress grows easily in pots or backyard water trays. Fresh, homegrown greens with 0 pesticides. The final food item is a very familiar one, but it's important for seniors to be aware of it: cooked purple cabbage. Red cabbage is rich in anthocyanins, the same natural pigments found in blueberries and purple sweet potatoes. These aren't just antioxidants, they're inflammation fighters specifically linked to renal kidney health. A 2020 clinical study published in Molecular Nutrition and Food Research found that daily intake of anthocyanins from red cabbage reduced renal inflammatory cytokines like IL-6 and TNF-alpha by up to 36% in patients with mild to moderate chronic kidney disease, CKD. That's a significant drop in it matters, especially when inflammation is quietly damaging your kidneys day by day. But here's what makes cooked red cabbage even better for older adults. Most people think raw equals healthier, but with red cabbage, cooking actually helps. A 2021 study from the University of Porto in Portugal, published in Food Chemistry, found that steaming red cabbage for 10 minutes increased the bioavailability of its anthocyanins by 25–30% compared to raw. That means your aging digestive system can absorb more of the good stuff with less strain. And because red cabbage softens as it cooks, it's easier to chew and digest a deal for older adults dealing with dental issues or slower digestion. High levels of potassium hyperkalemia can lead to irregular heart rhythms, while excess phosphorus can damage bones and blood vessels. That's why many healthy vegetables like sweet potatoes, avocados, and even tomatoes become risky for people with CKD. But cooked red cabbage? Here's what the USDA Food Data Central says. 1 cup cooked red cabbage contains 115 milligrams potassium, 22 milligrams phosphorus, 1G fiber, only 28 calories. Compare that to 1 cup cooked spinach, 839 milligrams potassium, 101 milligrams phosphorus. That's a big difference. In fact, red cabbage is classified as a low potassium, low phosphorus vegetable by the National Kidney Foundation, making it one of the safest and most versatile options for renal diets. Doctor's tips. Start with 1/2 to 1 cup cooked red cabbage, 3–4x per week. Best preparation. Steamed or lightly sauteed in olive oil. Add apple cider vinegar or lemon juice. Helps with taste and absorption. Avoid heavy sauces or salt if you're managing blood pressure. You can store cooked red cabbage in the fridge for 2–3 days. It reheats well and pairs beautifully with lean protein. So now you've seen the 6 powerful, kidney-loving Foods Fresh lemon juice, red grapes with seeds and skin, seaweed, purple sweet potatoes, watercress, and cooked red cabbage. Each one backed by science, each one gentle, natural, and accessible. But remember this, knowledge only helps when we act on it. Maybe it starts with swapping one vegetable this week, or adding a splash of lemon in your morning glass of water, or rethinking what you eat when your kidneys whisper not scream for help. Your health doesn't have to decline with age. You can protect your kidneys, you can feel better, move better, and age with power starting in your kitchen. And if this video gave you something useful, one small thing, please give it a thumbs up, share it with a friend who might need it, and don't forget to subscribe to Elderly Health Tips for more science-backed, easy-to-follow advice just like this.